everyone, and welcome back to another episode of Level Up Your Mental. My name is Ariel, and I'm a licensed mental health counselor. Today, we're back with another informational but sad video in regards to passing. Seems like there's been a lot of passing lately, which sits very heavy on my heart, especially when it's somebody at such a young age, and it's not anything as far as health related, natural causes, things like that. So it's just very sad to hear about. So today I wanted to talk about Mary Cosby's son, Robert Jr., that passed away. Mary Cosby is part of the franchise of Real Housewives of Salt Lake City, and her son, Robert Cosby Jr., has had substance abuse issues for a while now. So Mary Cosby, like I said, is known for being on Real Housewives of Salt Lake City, and she joined back in 2020. She became one of the most talked about members just because of her background and the things that she is in. So she is a Pentecostal pastor, and she inherited leadership of a family church in Utah. The one big thing that was a big controversy that had her name everywhere was the fact that she got married to her step-grandfather, Robert Cosby Sr. It was a decision that she said was tied to her late grandmother's wishes regarding the church leadership and family legacy. So throughout her time at Salt Lake City, Real Housewives of Salt Lake City, she faced a lot of criticism, intense media attention regarding her church, her finances, and personal life. They actually came out with a documentary based off of everything that had happened. It didn't really get great feedback because they said a lot of the stuff that was used in there wasn't really that great of information. But it is something that I just wanted to bring up. It's something that people are interested in looking at. Now, she was also known for her motherhood with her relationship that she had with Robert Cosby Jr., which is in this picture with her, who struggled with substance abuse issues, which they discussed publicly on the show. When it comes to Robert Cosby himself, and this is off of stuff that they said in the show, so I don't want to bring up anything that we know may not be true. But when it comes to him, he came onto to Real Housewives of Salt Lake City back in season 5, which aired in 2024. He began using drugs at the age of 16, and he said that he started off with Xanax when he was at a party. He said that he experimented with a lot of drugs, including Adderall, oxycodone, cocaine, Molly, LSD, and at times he said that he was taking as many as 10 oxycodone pills at once, explaining that he couldn't feel anything anymore. During that season 5 conversation, he also spoke about his mental health struggles, including expressing feelings of worthlessness and admitting to suicidal thoughts at times. After the episode aired, there was a lot of public stuff going on, and they basically said that he was confronting his addiction and that he had completed a 30-day rehab program back in 2024. His mother and himself both said that it was a step towards recovery, and Mary saying that, at the time he was coming out to be a new person. However, during his recovery, and in the later episodes, you can tell that he was still struggling with substance use. Along with that, he also had a DUI charge back in 2022 where he pled guilty. And then in 2025, he was arrested on charges including criminal trespassing, assault, and violating court orders related to a domestic incident involving family members. He spent time in jail and was released a few weeks before his death in February, which was about last week or so, and had been placed on probation and community service. So despite his efforts of recovery, his substance use remained a central challenge in his life up until his death at the age of 23 in February, which authorities have linked to a medical emergency involving a suspected overdose. The main reason I wanted to talk about this is because I want people to be aware of substance abuse, addiction. Any of that can happen at any age, especially when you are a young adult and you are curious and you have friends and people that hang around you that automatically use medication for other uses, but will sometimes experiment to try and see what that looks like. And a lot of it is because people will use substances in order to deal with the things that they are having a challenge with in their lives. So it doesn't necessarily solve the problem, but it helps them to numb the pain temporarily so they don't have to think about it. And that's where the addiction continues to happen is that you're sober and you're feeling everything that's going on. So when you don't want to feel that, you use the drugs, and when you start feeling yourself getting sober again, you start to continue to use because you don't want to feel those emotions. You don't want to have to think about the things that are going on. And also, a lot of people like the feeling of substance use or the feeling of using substances and what that does for them. So Mary and her husband definitely put out a statement just saying about how, with them, that he was called home to be with the Lord, and that they love him and they cared for him. And we could really tell in previous conversations that she had with him, and just how she spoke about him, and the things that she posted for us to see on the show and online, that she really tried. And that's the thing with substance use, is that you can try, but it's really going to be up to that person of when they feel like they want to stop and want to be sober. The thing with substance use is that it is treatable, in the sense of making sure that you get help with your decision making skills, your impulse control, and your emotional regulation. But a lot of the times what happens in our world and the things that we see now is that, and I guess it's things that have happened before in the past, but using substances has always just been a normal thing. I mean, we live in a day and age now where a lot of this stuff is glorified. Back in the day, this was stuff that was put in movies and on TV shows of people just using substances. And addiction can come at you very fast. You might not know that you are addicted, but you are consistently using this, and you can't go without a moment without using it. And that's where the issue lies. And a lot of the times what we will see in addiction is it's usually a way for people to mask their pain. They would rather use the substances and have that be a reason and distraction to help them feel a little bit better than to actually sit with whatever it is that they are going through. It's such a hard conversation to have when people pass away from it, because we know that it could have been prevented, in the sense of they can get the help and the treatment. But the thing is, it's not that easy when it comes to addiction. When somebody is addicted to something, they will do any and everything to be able to get to that. And sometimes for them, that is more worth it than to actually sit there and deal with the things that they are going through. And a lot of times we have seen that people who have addiction history is that they will go out of their way in order to get the stuff that they need. A lot of times when they do go into treatment, it's very hard to keep them sober and for them to have sobriety for long periods of time, because just going through the withdrawal period and going through detox can be very, very excruciating. I mean, I worked in a detox center, and it is not easy seeing people go through that. Your body is literally letting out all the toxins of all the things that you have been drinking, and it is craving that alcohol because it's so used to having it, or whatever drug it is that you're using. And for people, the pain is just so unbearable that they would rather just go and use the substance to relieve that pain than to sit there and go through rehab, go through treatment, go through detox, because they don't want to deal with that. And I think there comes a point too where people who have addiction also, I don't want to say that they don't care, but a lot of them are aware that it can cause medical issues, but because they don't actually see those things happening and they're still able to drink or use the substances and go about their day, that isn't really a thought that's in the back of their mind. At the end of the day, they want to just get to the root cause of it all, and to be able to, not the root cause, they want to get to getting to that feeling where they're not in pain anymore. And it sucks, but that is the truth when it comes to addiction. When it comes to addiction is a chronic relapsing brain disorder. It is characterized by compulsive substance use despite harmful consequences. It affects brain circuits related to reward, motivation, memory, and self-control. It's not a lack of willpower, it is a medical condition. Now, I know people are like, oh, there are certain people who are not educated and just don't know and just think, oh, well, why can't they just stop? You know, their brain, their body is so used to taking this in that it doesn't know how. It doesn't know what that sober feeling feels like. So when they try to get sober, like I've said before, it's very hard for them. And for some people, that pain is just too much that they would rather just continue using. And people also like the feeling of how those drugs make them feel. So addiction could be two things, right? It could be substance addiction, it could be alcohol, opioids like heroin, prescription painkillers, stimulants like cocaine, meth, marijuana, and prescription medications like benzos and Adderall. And there's also behavioral addictions like gambling, gaming, shopping, social media. Those can also be addictions too. As hard as it for people to see, those are things that people can get addicted to, and it can create issues in the future. Now, how addiction develops, it really just depends on the person, but in general, it's usually an experimentation, or sometimes people will be prescribed prescriptions to use for something else, like painkillers. Somebody will get into an accident, and so the provider will give them medication to help with the pain. And for some people, they get so used to what that feeling feels like that they are now using this even when they don't have any pain. Sometimes experimentation, like same thing with Adderall. A lot of kids will take that in order to help with school, to be focused. But then you get so addicted to it because it's helping you in the sense of doing your work that you like that feeling, and so you just keep using it and keep using it. Now, with the brain, it releases dopamine, which is a pleasure/reward chemical. When they're using this stuff, this is what's feeding into their brain and making them feel good and wanting them to keep using. Now, their tolerance develops as far as like needing more for the same affect or the same effect. So with their tolerance, once it's like with drinking, it's something that I can say for, because we live in a world where drinking is glorified, right? Drinking is literally everywhere. There's commercials for drinking. It's all over the place. You go to a bar, it's just acceptable. You turn 21, you get your first drink or whatever, like your first legal drink or whatever the case may be. So we're not going to pretend that, drinking is not out there in our culture and what that looks like. That's just what it is as far as when it comes to the things that we have seen and what we have grown up around. Drinking is something that is acceptable. When people come home from work, I need a drink, I need a cocktail. End of the week, Friday, I need a drink, I need a cocktail. Why? Because it's been so stressful. They want to get their mind off of things, and that's what the substance does for them, whether that is alcohol or something else. That's the whole point, is to get their mind off of things and to help them relax. So when it comes to developing a tolerance, a lot of times people know what they can handle, especially when it gets to the point of them being drunk or being belligerent. So for a lot of people, they know that, I can have one or two drinks and I'm fine, I'm good, it's not going to be an issue. But there are some people that they don't know what their tolerance is, or there are some people that they get so used to what it is, and so they want to up the dose and just keep more because they don't feel anything. They want to just keep using because that tolerance level that they have has now grown even more, and they need more in order to get to that feeling. The other thing is the dependence, right? The withdrawal symptoms when stopping. Dependence forms when you stop using and you start feeling all those symptoms and you want to go back to it. Or somebody tries to take something away from you that you're so used to doing, like you're so used to drinking every week, you're so used to using these substances every day, every other day, and then when somebody tries to tell you to stop to do it, it's an issue now, and you're just too afraid to pull back, or whatever the case may be. The other factor is compulsive use, despite the negative consequences. So they don't really care about what the negative responses might be from this thing. They know that I need to use this and I'm going to continue using it. No matter if I get a DUI or I get in trouble, the addiction is just that bad that I want to use this thing instead of trying to, continue to be sober. It's just my norm. It's what I'm used to. It's what my body needs. And it's just something I feel like I have to continue doing. Now, when it comes to addiction, what does the signs look like? So for a lot of people, you lose control over the use. So it's not like, this week I'm going to go out to drink. It's like, no, I need a drink every day after work and as well as the weekend. I haven't not had a drink every week in so long. That is when you start to lose control over your use. You have cravings. Some people, I work with people where it's like they wake up first thing in the morning is they need a drink. Throughout the day, they need a drink. The drinking has gone so bad that they have to get it delivered to their house because they can't leave or whatever the case may be. So you have a certain craving all the time for this specific thing, and you have to feed into it or else it's going to drive you crazy. You have withdrawal symptoms, like I was saying, for people that have been in detox. Those withdrawal symptoms is sweating, stomach aches, pain, they're throwing up. Dealing with all that stuff while you're being sober, it sucks and it's really, really hard. So for some people, that's just too much. They would rather just deal with using the substances than have to deal with those withdrawal symptoms. We also have neglecting your responsibilities. So you are finding ways to go drink and do everything that you need to do, and you're just completely forgetting about showing up for work on time, completing your tasks, paying your bills, taking care of your family, taking care of yourself. It also causes relationship problems. The people in your life see that you're starting to drink more, and then for you it's like, no, this is what I do, but the people can see that you're slipping and that you're changing. And for a lot of people, that's very hard for them to stick around and deal with. So a lot of people, it creates relationship problems because a lot of people don't know how to deal with it. They don't know what addiction is. Like I've said, a lot of people are like, oh, just stop using and you should be fine. But for some people, they can't do that. It's very hard for them to just stop using. You don't go from using very hard to just stop completely because somebody wants you to stop and you think that that's just going to be enough. It also might create legal or financial issues. So you might be getting arrested for DUI, things like that. You're getting behind the wheel drunk. Or you might be using your money so much to feed into this addiction that you're not having enough money to pay your bills. You're taking money out of other places that you shouldn't be. Maybe your kid's college fund, maybe your savings, just so that you can feed into that craving of the substance use. And then the other thing again would be just continued use despite the harm. You know that the last time that you drank this much or you used this much substances, that you had to go to the hospital. But that doesn't stop you because again, the addiction is so bad that you would rather just give in and take the substance use or take the substances instead of the possibility of ending back in the hospital again, or your bodies or your organs shutting down. These are things that actually happen. Now when it comes to substance use disorder, it's especially among young adults. Like I've said, kids that are young, 20 years old, that's usually when it starts, when they go off to college, when they're around their friends. I can even remember kids drinking when I was in middle school. When I was in middle school, there was a girl that would come to school and she would put alcohol in her water bottle, and it was vodka or something that was clear so that teachers wouldn't even notice. And in my brain, I would sit there and be like, what? That doesn't even make any sense. But you think about it now and you look at it and you're like, you must have been going through a lot or just wanted to show off to your friends. But you must have been going through a lot if you wanted to put alcohol in your water bottle and take it to school and use it regularly while you're at school. Like, you have to be going through a lot for you to want to do something like that. With it being treatable, it can be very hard. You want to save someone's life that's dealing with addiction, but at the end of the day, it's really up to them. There are some warning signs that people just need to be aware of if you have people in your family that might be dealing with this. So it might be isolation or withdrawal from family and friends. If you don't hear from this person, you know that they have a substance use history and they've pulled back a lot. That's a time to check in with them, see how they're doing, what do they need, what's going on. And again, you can help people so much that you can, but at the end of the day, it is going to be up to them. They have to want it for themselves. You cannot want it for them and for that to be enough. They might have sudden mood swings or behavioral changes, right? They might have been a easygoing person and now they're so tense. They're always upset. There's always something going on. They're continuously spending, continuously using. They don't do the things that they used to do. They're home just drinking and stuff. Like, those are changes that if you know someone enough, you can see the difference. The legal and academic issues, again, if they are in school, they're not doing their homework, they're not showing up for classes, they're not doing what they're supposed to be doing, they're continuously getting arrested, they're getting DUIs. Those are things that you can see as a warning sign that this is clearly an issue and something needs to happen. And there might also be physical symptoms like changes in their sleep, their weight, their energy. Those are things that you can visibly see that might be an issue. Now, that's not for everyone, but I think that that might be a possible warning that will let you know, okay, I clearly need to check in with this person and let them know what's going on and what I see. And it's going to be up to them to get the help. We can take them there, but we can't force them to get the treatment. There is a continued overdose crisis in our country. It continues to be an issue, especially when it comes to opioids, fentanyl, things like that. With my experience, I have worked with different ages when it comes to substance use, and I have been taught how to use a Narcan kit and what that looks like. It's not something that you want to think about, but it is something that is important for you to know. So if you're ever in a situation where somebody does pass out from using substances, you do know how to use a Narcan and how to access one. I believe you can get Narcan in places, but it is important if you know that there's somebody around you that's using it and they're not getting the help for you to have one and to know how to use it. There's also medication assisted treatment that I've also had the experience of being around. So for people who are going through withdrawals, there's medication assisted treatment, which basically just helps them to get off of the substances by using another substance. So medication assisted treatment is a whole person approach, right? They use medication and combine with counseling, behavioral therapy, and peer support to treat the substance use. Methadone itself is a long-acting synthetic opioid agonist medication that can prevent withdrawal symptoms and reduce craving in individuals with opioid dependence. It can also block euphoric effects of illicit opioids. It has a long history of use and treatment of opioid dependence and is taken orally. A lot of times you'll go to your provider and they'll give it to you as an injection, or they will give you these tabs that you can take and it helps you. What it basically does is you take it and it basically stops you from using. So if you were to use, it makes you sick, it makes you throw up, it basically prevents you from using again. Now there's two different kinds. They have Suboxone, which acts like a partial antagonist to opioid receptors, but it does not produce the euphoric and sedation caused by heroin and other opioids. It's able to reduce or eliminate withdrawal symptoms associated with opioid dependence, and it carries a low risk of overdose. So you can possibly overdose from one of these, but it's very, very low. Now, this is the one that comes in two forms. You can either take it as a pill, it goes underneath your tongue, or you can get it as an injection, which you'd have to come into the office and do. This one is usually more commonly prescribed. We also have naltrexone, which is Vivitrol, and that's another synthetic opioid antagonist that blocks opioids from binding to the receptors and prevents the euphoric and sedating effects. It has no way of you getting addicted to it, but it definitely helps you when it comes to using. It'll stop you from trying to use. It'll make you sick, make you nauseous, and basically just helps you. So it's another type of medication that you can't necessarily get addicted to, but it helps you in the sense of, if you go and try and use, it's going to make you throw up, it's going to make you sick, and basically just tries to prevent you from using. Your provider usually helps you to follow up with them, making sure that it's going well, if there's any changes. Like I said, you can also get it injected, and you'd have to go to the office in order for it to happen. Now, when it comes to addiction, it's not usually just addiction. Sometimes it's addiction and some type of mental health disorder. So you could be struggling with addiction and also have depression, anxiety, trauma, and other mental health challenges, right? So you have to learn how to treat both. Sometimes people will be dually diagnosed, so they will have a substance use disorder and then a mental health disorder, and so you have to treat both. In order for you to get over the addiction, you have to treat what's going on with the depression, the anxiety, the trauma, what is leading you to drink. A lot of times substances is, like I've said, from something else. Something is bothering you to the point that you feel like you need to use these substances to kind of get over the situation or just try to push through it. Mary's son's situation, he was very young. He was 23 years old. He had been to rehab before. He's had legal issues, had issues with family members. We don't know exactly what it is that led him to get to this point, but we do know that it was an overdose, so he was using more than he was supposed to. And it just sucks because at 23 years old, you have a whole life to live. And I know she tried her best to keep her son around and to make sure that he was good and to get him the help and not overstep. But that's the problem with addiction. It's very hard to get people to get the help when they don't see that it's an issue, or they're hurting so bad that they would rather use the substances than to get the help. Even with him being in jail, she knew that this was the best way to keep him safe. Him being away and being locked up and not being able to use was the best way for him to be sober. But unfortunately, with him being released and coming out, he was just right back out there and able to use again. And it's just so unfortunate for it to happen that way, because no parent wants to bury their child, and no parent wants to bury their child based off of mental health or substance use issues, something that a lot of times they feel could have been prevented. And like I've said before, it's really up to the person if they feel like this is something that they want to work on and something that they want to improve. But it's unfortunate, as a parent, you can't make your adult child do anything. You can try as much as you want and let them know that you support them, but at the end of the day, it's going to be up to them. And I think with Mary, she tried a lot and she did everything that she could, and his addiction was just too strong, and it was very hard for him to get the help. I know that, there's a possibility that he could have gotten the help, but it seems as if the things that he was dealing with was a lot, and he just wasn't ready for that yet. And it's unfortunate that we lost him to an overdose, and I know Mary is hurting right now, and I'm hoping that she doesn't put any blame on herself because of this, because it's very hard. And I know a lot of people do resort to that and they self-blame, but like I've said before, addiction is very hard. You can tell someone that you love them and you care about them so much, but it's going to be up to them for them to see the worth within themselves and to understand that the addiction is not worth it, the substance use is not worth it, and that they have so much more of their life to live, and they can become sober at any time. And again, when it comes to substance use, you can relapse. And I know I know that he had moments where he relapsed, and that's not something to put blame on someone, but it happens, and it's unfortunate, and it's something that we don't want to happen, but it is part of the substance use issue and the addiction issue. And it's very hard working with people who have this, because it can be an up and down. Someone can be sober and you think that you're good working with them, and then all of a sudden something happens in their life and they don't know how to deal with it, so they just run to that, and then they're too ashamed to come back to you, so they just keep using. I just hope that this puts out a message to our young people out there to understand that addiction is not the answer. I know that in this day and age, therapy can be a bit of a no-go for a lot of kids. They feel like it's pointless to come and talk to somebody. They don't want to be put in somewhere, whatever the case may be, but you have your whole life to live. I know some of the things that people go through are very hard and they don't know how to deal with them, but please allow other people to help you. Please allow other people to teach you the ways to deal with these things, because we are going to go through hard things in our lives, and using substances is not a way to deal with them. Like I've said before, it'll help mask the pain, it'll help you temporarily with the symptoms, and when you wake up the next day, you're still dealing with those same issues. So if we could just work towards being more kind with people who have substance uses, and try to get the education and get the support as family members and friends, and figure out how we can help them, but understand at the end of the day, it's not our fault, and it's really up to the person to know when they are ready to get sober. So I want to thank you guys for watching another video. Please let me know what other content you would like me to do, and I will see you guys in the next one. Bye.